Hey everyone, and welcome to PTCB Prep Guide. So, are you staring at hematology in your study guide and feeling just a little bit overwhelmed? Don't even worry about it. Today, we are going to make white blood cells and platelets totally crystal clear for you.
Yep, we're going to break down everything you need to know, what white blood cells and platelets do, what happens when things go wrong with them, and of course, the key medications you'll see on the exam. And we're doing it all with some really simple visual slides to help it all sink in. So, you ready? Let's jump right in.
All right, first up on the agenda, white blood cells, or WBCs for short. The easiest way to think about these guys, they're basically your body's personal security team. I mean, they're on patrol 24/7, just looking for any sign of trouble, especially infections.
So what's their main job exactly? Well, WBCs are your #1 line of defense against infection. And here's the key takeaway for your exam, the thing you really need to remember. If those WBC counts drop too low, the risk of getting a serious infection, or even certain cancers, goes way, way up.
Okay, so we know what they're supposed to do. But what happens when things go wrong? Let's dive into some of the major WBC disorders. And just a heads up, these are super high-yield topics for the PTCB, so you'll definitely want to pay close attention.
And here's our first one. You see that little warning icon? That means this is a big one. It's called neutropenia. Seriously, anytime you see that icon, your brain should go, okay, I really need to know this.
So, what in the world is neutropenia? Well, it's just a fancy word for having a low count of neutrophils. And neutrophils are a specific type of white blood cell. Think of them as the immune system's first responders, especially for bacterial infections. Now, a huge cause of this is chemotherapy. And because of that, you have to know the drug Filgrastim. The brand name is Neupogen. Its whole job is to boost WBC production, which is a total game changer for cancer patients trying to avoid dangerous infections.
Okay, moving on to our next high-yield disorder. This is a word I'm sure you've heard before, leukemia.
So, leukemia is a type of cancer that starts right in the bone marrow. What happens is the body starts making all these abnormal, useless white blood cells. And these faulty cells just start to crowd out all the good, healthy cells. See how that explains the symptoms? You get fatigue because there's no room for red blood cells, and you get tons of infections because your functional WBCs are missing in action. The treatments, as you can imagine, are pretty intense, usually chemotherapy or even bone marrow transplants.
And the third big WBC disorder you need to lock into your memory is lymphoma.
Now, this is an important distinction. While leukemia starts in the bone marrow, lymphoma is a cancer of the lymph system. You know, your lymph nodes and all that. And that's exactly why the classic telltale symptoms are things like swollen lymph nodes, fever, and those really distinct night sweats.
All right, so we've talked about the body's security team. Now let's switch gears and talk about the emergency responders. I'm talking about platelets, or as I like to call them, your body's official clotting crew.
Their job is so simple, but so important. Whenever there's an injury, they literally rush to the scene, stick to the damaged blood vessel, and start forming a clot to stop you from bleeding. So here's the bottom line. WBCs fight infection, platelets stop bleeding. That's the core concept. And it makes sense, right? If your platelet count is low, you're going to bruise easily and have a much higher risk of bleeding.
And you guessed it, just like with WBCs, when things go wrong with platelets, it can lead to some pretty serious disorders. So let's cover the key bleeding risks you need to have on your radar.
First on the list is an absolute PTCB classic, hemophilia. For sure, this is a big one you need to know.
Okay, so hemophilia is an inherited disorder. That's key. It means your body is just born not making enough of certain clotting factors. The two main types you've got to know are hemophilia A, that's a lack of factor 8, and hemophilia B, which is a lack of factor 9. So how do we treat it? Well, it's pretty logical. We replace those missing factors. Or, for some cases, we can use a drug called Desmopressin, which you'll probably see as DDAVP.
All right, our second major platelet issue is a mouthful, thrombocytopenia. All that big word means is a low platelet count. Simple as that. And unlike hemophilia, which you're born with, this is a condition that can be caused by a whole bunch of different things. Certain meds, autoimmune issues, even chemo. Treatment is all about fixing whatever's causing the problem in the first place, or, if things get serious, giving the patient a platelet transfusion.
Okay, awesome. We've gone over the cells and the disorders. Now let's tie it all together with a super handy, quick reference guide to the top medications you're going to see on the PTCB for these conditions.
I love this slide because it's the perfect little summary.
it connects the dots for you. You've got Filgrastim for neutropenia to boost those WBCs. You've got clotting factors for hemophilia to replace what isn't there. Desmopressin also helping out with hemophilia. And then steroids or IVIG, which are used to calm down the immune system in some types of thrombocytopenia. This right here, this is the practical drug to disorder knowledge that gets you points on the exam.
All right, we're in the home stretch. It's time for the final exam cram session. Seriously, if you only have 60 seconds to review this topic before you walk into your test, this is the slide you need to burn into your brain. These are the absolute must-knows.
Okay, let's lock this in together right now. WBCs fight infection. So, low WBCs means high infection risk. Easy. Platelets help with clotting. So, low platelets means high bleeding risk. Got it. And the key meds, Filgrastim, clotting factors, DDAVP, and steroids. That's it. Simple, clear, and 100% essential.
And just like that, you've got a solid, high-yield guide to WBCs, platelets, and all those related disorders for your PTCB prep. Our whole goal here is to take these tough topics and break them down into these easy visual lessons to make your studying way easier and faster. So hey, if you found this helpful, make sure you subscribe to PTCB Prep Guide. We've got a lot more simplified pharmacy topics and exam-focused explainers coming your way. Keep up the amazing work. You've got this.